Now you start general inspection. Turn around, raise up, turn around, turn around, turn around. Look for me. Pacients look older. Activity posture. Constitution normosthetic.
The skin is pale and dry. Subcutaneous fat is inspected over the biceps muscle, the triceps muscle, and below the angle of the scapula. Subcutaneous fat development is symmetrical and there is no local deposition of fat. Edema is inspected on the lower extremity and edema is absent. As for the locomotor system, active and passive movements are normal. There is no tonic or clonic convulsions. Bones were not deformed. There was no periostitis. Percussion of the bones were painless. Joints have normal range of motion, active mobility. Temperature over the joints were not elevated. Palpation was painless. The vertebral column is not deviated. There is no pathological curvature. Percussion over the spinous processes were painless. The conjunctiva were not icteric. There was no hemorrhages. The thyroid gland was not enlarged and it was unpalpable. Surface palpation of the chest revealed no pain. Vocal fremitus is symmetrical on both sides on the anterior and posterior aspect. The patient says 33 and the doctor feels for any change in vibration. During topographical percussion of the lungs, the borders of the lungs were within normal limits, while comparative percussion revealed clear resonant sound over lung parenchyma. Auscultation of the lungs revealed normal vesicular breathing without adventitial sounds such as rales, crepitation, or pleural friction rub. Moving on to inspection of the cardiovascular system, there is no cardiac humpback, no abnormal pulsation seen on the neck or on the chest. Apex beat was found to be 1.5 centimeters medially from the left midclavicular line with an area of 2 centimeters square. Aorta, pulmonary trunk, and aortic arch is unpalpable. There was no epigastric pulsation. Percussion of the heart revealed normal configuration of the heart, with the right relative border being in the fourth intercostal space by the right sternal margin. The left relative border is on the fifth intercostal space 1.5 centimeters medially from the left midclavicular line, while the upper border is on the level of the third rib. Upon auscultation of the heart, the rhythm was regular with a rate of 110 beats per minute. There were no pathological sounds such as murmurs.
Open your mouth. Show your tongue.
Oral cavity is odorless. All teeth are present. Mucous membrane of the hard and soft palate is pink. Tongue is pink with red shade. Is dry with no deviation.
Have pen?
No.
Do you have pen?
No.
Do you have pen?
No.
Have pen?
No.
Pen?
No.
Do you have pen?
No.
Have pen?
No.
Have pen?
No.
Superficial palpation of the abdomen was painless. Rebound tenderness was absent and Mendel's sign was negative.
Inhale. Exhale.
During deep
Inhale.
bimanual palpation of the kidneys by
Exhale.
Botkin, kidneys were unpalpable.
Exhale.
Pasternatsky sign is negative.